Today, we are excited to welcome Cecilia Yu, a healthcare leader with a robust background in public health, data analytics, and healthcare administration. Cecilia is currently an administrative fellow at Baylor College of Medicine, where she leads initiatives to enhance healthcare operations and patient care delivery. She's also held impactful roles at institutions like the Cleveland Clinic, Maximus, and the UNC School of Medicine, contributing to oncology services, public health data modernization, and patient-centered care strategies. With degrees in chemistry and biology from UNC Chapel Hill and a Master of Healthcare Administration from the UNC Gilling School of Global Public Health, Cecilia combines academic rigor with real-world expertise. Our discussion will explore Cecilia's journey, her achievements in healthcare innovation, and her advice for aspiring professionals. Cecilia, welcome.
Thank you.
Just to start off, reflecting on your journey, what initially sparked your interest in healthcare and public health?
Yeah, of course. Thank you for having me here today, Atlas. I think my interest for the healthcare journey really began at a young age when I witnessed, when I was a kid, my grandpa was getting a lot of care in the healthcare field and he was sick very often. So just witnessing that as a child and then also seeing the impact that the care teams were able to have on my family, I wanted to give that same kind of impact back in the future in this field. But it wasn't until later on when I discovered my passion for public health. So that was during undergrad at UNC Chapel Hill when I worked as a clinical researcher for the UNC School of Medicine. So I worked at a clinic that primarily serves Spanish-speaking communities in Siler City and Prospect Hill. And during my time there, I noticed a lot of healthcare inequalities. So that's kind of what made me want to change my path from being pre-med to working at a more institutional level and making those judicial changes as well.
How did your experiences at NCSM and your undergraduate studies at UNC, shape your decision to pursue a career in healthcare administration?
Yeah, of course. Some of my favorite classes were actually at NCSM, and I think my time with NCSM really helped me to shape my decision to pursue a career in healthcare administration. I enjoyed a lot of my classes there, like organic chemistry with Dr. Spells, chemistry with Dr. Naiman, and I think in taking some of these courses, it made me realize how passionate the professors were. And during my time, a lot of the professors were concurrently conducting research. So that also sparked an interest for me in healthcare that way, particularly in research. And I was able to apply for the mentorship program, and I joined the Sherwood Lab at Duke University to study cancer cell metastases, primarily focusing on the model organism C. elegans. And one of my lipid metabolic enzymes actually was found to have statistical significance. So that was later published too. So I think overall, NCSM really helped me a lot for me to pursue a career in healthcare.
That's really fantastic. Now, as an administrative fellow at Baylor College of Medicine, what are your primary responsibilities and what leadership skills have been most critical to you and to your role?
Yeah, so currently I serve as an administrative fellow at Baylor and I work in the office of the president. So I really think of myself primarily as a catch-all person, whatever the college needs in terms of operations and projects. So my role is primarily managing projects. So I'm project managing 10 right now for the central team. And when I say central team, I mean in the organization, we have central operations, which are usually supply chain, central finance, education, research. And then we also have departmental teams. So that's more like Department of Medicine, Department of Surgery. So I'm working on 10 projects right now for the central team and then managing another 10 for the rotation that I just wrapped up with the Department of Medicine. So it's all been a lot of good fun, a lot of learning, but I was able to sharpen my skills in project management. And in terms of skills that you asked were most crucial to my role, I think they would be understanding and compassion because I feel like as a leader, you really need to understand the people that you work with and really care for them beyond just the output that they are providing. And I feel like providing and forming those kinds of relationships really also motivates them to do better work and to really align with the organization too.
That's great. Well, it sounds like those projects are certainly keeping you busy. Could you share, could you share a project or initiative during your time at Baylor that has been particularly meaningful or impactful?
Yeah, sure. I think a lot of projects come to mind, but if I were to share one project that was particularly meaningful, I would like to talk about the Comprehensive Neurophysiology Program. As a fellow, I had the opportunity to build a business case to develop the Comprehensive Neurophysiology Program for the Department of Neurology. And this project was difficult for me in the beginning in terms of finding out the stakeholder analysis, meeting the needs of the organization, but also lining up with leadership. So this project helped me to work better with nurses, physicians. And I also thought this was meaningful because I was able to triage the billing process. And I think a lot of times in healthcare, we have a lot of confusion with healthcare prior authorizations, billing systems, and who is paying who, especially with Baylor being such a large health system and having a lot of affiliates as well. So I think it was impactful in the way that it helped the patients meet their needs, but also helped the Department of Neurology really align to the overall Baylor mission too.
Now, during your internship at Cleveland Clinic, you managed multiple projects, including standardizing workflows and improving patient imaging intervals. So, could you discuss the challenges and successes of leading these initiatives?
Yeah, definitely. I think one of the biggest challenges that comes to mind during my time there is mainly as a young professional trying to change the process that people with decades of experience deal with every day. So, of course, they know the most about the process. And I think as a young professional in these situations, it's oftentimes hard for people to see you as the driver change or to see you in that leadership role. So, I think that was something that was difficult for me. And as for successes, I think there were successes towards the end that made me really proud. I was able to hold town halls, leading 46 different divisions of the nursing staff at Cleveland Clinic. And I was able to ask them to share their advice for what do they want to see changed. And these were really successful in terms of me planning the different swim lanes, planning the different initiatives. So I think the success was really involving everyone together on these types of projects.
Wow, those challenges and successes sound like they were very impactful. From those, what lessons did you take from this experience that you've applied to your current work?
Yeah, for sure. I would say the lesson that I learned is it served me best when I would just roll up my sleeves and get to know the frontline staff because I think that getting to know their processes will give you a whole new perspective because I believe that you can't change a process that you know nothing about.
That's fantastic. You can't change a process that you know nothing about. I appreciate that. That's good wisdom right there. So your work at Maximus focused on improving public health data systems for the CDC. So how did this role influence your understanding of the intersection between data analytics and healthcare operations?
Yeah, I think that healthcare operations is really built on data. And personally, I really enjoy the work that I did for the CDC, where I led the scalable systems team in building healthcare infrastructure. So, really decreasing that mortality tracking lag time from state jurisdictions to the national level. And I think this helped me a lot with understanding the connection between data analytics and healthcare operations. And that's something that I still hold dear in my role today.
That's fantastic, Cecilia. Now, throughout your career, you've engaged in research and mentorship from your time at UNC to volunteering with a minority undergraduate internship program. So, how have these experiences influenced your approach to leadership?
Yeah, I've always loved giving back and paying it forward to my community. So, volunteering with the Minority Undergraduate Internship Program at Cleveland Clinic was actually one of the highlights of my time with them. I really enjoy serving as a mentor to one of their undergrads in the internship program. And I think it brought me a lot of fulfillment when I was able to connect her with certain people and to also find internal and external contacts. And really like watching her thrive help me feel better about mentorship as well. And I think that has really influenced my approach to leadership in the sense that throughout my career, I hope to continuously give back and paying it forward.
What role do you think mentorship plays in fostering innovation and equity in healthcare?
Well, I think that's an excellent question. I think mentorship, in my opinion, is the only way forward. And I think about all the roles that I've been privileged to serve in. And in each of these roles, I've been fortunate to have amazing leaders who have been phenomenal mentors to me. And so I think about my time just in Baylor currently, and I work for the head administrator of global programs. And he has given me the most welcome into Houston, a city that I really have never been in. And so I think he served as a wonderful mentor to me in my both professional life and personal life. So I'm truly grateful to him. And I also work directly for the chief of staff at Baylor, and she has been a phenomenal mentor to me as well, always making sure to connect me to the leaders across the organization and ensuring that the fellowship is aligning with my personal needs as well. So I think I've been fortunate to have amazing mentors in my life. So I want to do my part in terms of paying that forward in healthcare too.
That's great. Thank you for that. Now, just for students and young professionals aspiring to lead in healthcare administration, particularly at NCSM, what advice would you offer regarding skill development and career progression?
Yeah, I'm actually giving a talk at this year's American College of Healthcare Executives annual conference, and this is geared for early careerists, and we're actually focusing on this exact topic. And I think the advice that I would give primarily is really study whatever makes you happy because I believe that there isn't one major or even one graduate degree to healthcare administration. And I feel that I've always realized my field is incredibly diverse. And I've noticed that people in my graduate program, they came from backgrounds such as chemistry, biology, agriculture, business, economics. So I've always felt like you can pursue and study any path that you want and still end up in the place that you want to be. Because I myself didn't have necessarily the most cookie cutter path either, with me deciding very later on in life if I wanted medical school or graduate school. So that's why I NCSSM were some of the first resources that were really crucial to my growth. I believe that the connections that you make here really will help you along the way. For example, I'm still best friends with a girl that I was on the same hall with. Shout out to First Bell. And we still call each other once a week to really catch up with each other, even though life gets busy with me and my fellowship and her doing medical school up north. And I think that the teachers at NCSSM really helped me a lot. The professors were really invested in my personal and professional growth and helped me a lot in terms of shaping my career growth. I also think that the leadership at NCSSM is oftentimes an untapped resource. I know that Dr. Lynch helped me as I transitioned colleges after my first year of undergrad, and that was going from NC State to UNC Chapel Hill. And Dr. Roberts connected me to his sister-in-law who wrote my finance textbook during grad school. So I was able to have a really amazing conversation with her about pressing issues today in healthcare administration. So I really think that people who build you up over the course of your career are the ones that you should really think about and just don't forget to give back by helping the next ones in line.
Well, thank you so much for that, Cecilia. Well, we appreciate your time today and look forward to how you keep continuing to give back to the community. So,
Of course. Thank you so much for having me.